Common signs of diabetes in women. Did you know that diabetes can present differently in women? Often the signs are subtle and easily mistaken for everyday symptoms. In this video from Your Health, we will reveal 8 common signs of diabetes in women that you need to know to take early action and prevent complications. Understanding these body alerts is the first step toward better health. Watch until the end and discover whether any of these signs might be affecting you or someone close to you. Number 1. Yeast infections, candidiasis. Fungal infections, especially vaginal candidiasis, are common signs of diabetes in women and deserve attention. When blood glucose levels are elevated, the intimate area becomes an ideal environment for the growth of Candida albicans, a fungus that feeds on sugar. The result? Intense itching, burning, discomfort, and a whitish discharge that indicates an imbalance in the natural flora. These infections not only cause discomfort but can also become recurrent, serving as a warning sign of diabetes or poor glucose control. Many women treat candidiasis with creams or antifungal medications without investigating the root cause, resulting in only temporary relief. To break this cycle, the first step is to keep glucose levels under control. When blood sugar is within the ideal range, the fungus loses its main food source, making it harder for it to thrive. Wearing cotton underwear, which absorbs moisture better, and choosing breathable clothing help keep the area dry and healthy. Maintaining balanced, intimate hygiene, without overuse of aggressive products, is also essential. In cases of persistent infections, seeking medical guidance is indispensable. Number 2. Polycystic ovary syndrome. Polycystic ovary syndrome is a common hormonal condition in women and is strongly associated with type 2 diabetes. The link between both conditions lies in insulin resistance, which is a hallmark of polycystic ovary syndrome. In this condition, the ovaries enlarge and develop small cysts around them. The body in turn produces excessive insulin to try to keep blood sugar in check, but the cells do not respond properly to the hormone, leading to glucose buildup in the bloodstream. This resistance may develop into prediabetes or type 2 diabetes if left untreated. Additionally, polycystic ovary syndrome can cause irregular menstruation, excess facial and body hair, acne, and difficulty getting pregnant. Symptoms that, combined with glucose imbalance, require extra attention. Effective treatment starts with lifestyle changes. A balanced diet low in sugar and ultra-processed foods, along with regular physical activity, improves insulin sensitivity. In some cases, medications like metformin may be prescribed to help regulate hormones and glucose. Ongoing medical monitoring is essential to prevent diabetes, relieve the symptoms of polycystic ovary syndrome, and support overall women's health. Number 3. Skin changes. Skin changes can be one of the first visible signs of diabetes in women, even before the disease is diagnosed. These changes occur because high glucose levels affect hydration, circulation, and immune response, making the skin more sensitive, prone to injuries, and vulnerable to infections. Common symptoms include excessive dryness, constant itching, and the appearance of dark patches, especially in skin folds such as the neck, armpits, groin, and behind the knees. This condition, known as acanthosis nigricans, signals insulin resistance and often appears before a diabetes diagnosis. Additionally, the skin in these areas may become thicker and velvety. Another issue is skin infections caused by fungi and bacteria that take advantage of the moist, sugar-rich environment. Minor injuries may also take longer to heal, increasing the risk of complications. To care for the skin, it is vital to keep glucose levels under control. Drinking plenty of water throughout the day helps maintain skin hydration, while daily use of moisturizers prevents dryness and cracking. Choose fragrance-free, neutral products to reduce the risk of allergies and irritation. Good hygiene, avoiding very hot showers, wearing comfortable clothes, and using proper sun protection are simple habits that make a big difference. If skin changes persist or worsen, a dermatologist should be consulted. Professional monitoring can identify early signs of diabetes, offer personalized care, and help maintain healthy, comfortable skin. Number 4. Tingling or numbness in hands and feet, peripheral neuropathy. Tingling, numbness, or even burning sensations in the extremities, especially hands and feet, is a classic symptom of peripheral neuropathy, a common complication of diabetes. This condition occurs when high blood sugar damages the nerves, disrupting signal transmission and leading to abnormal sensations. Many women describe the feeling as pins and needles or electric shocks in their feet, worsening at night or after long periods standing. Over time, the loss of sensation can worsen, increasing the risk of unnoticed injuries. Glucose control is the foundation to stop neuropathy progression. A balanced diet, Regular physical activity and adherence to medical recommendations help stabilize blood sugar and preserve nerve function. Foot care becomes an essential routine. Inspect them daily, keep the skin moisturized, trim nails carefully, and wear comfortable, appropriate footwear. Treatment for pain relief and nerve recovery may include medications, physical therapy, and even acupuncture, depending on medical advice. Regular checkups with endocrinologists and neurologists are crucial to track progress and adjust treatment strategies. Recognizing these symptoms early helps protect nerve health and maintain independence in daily activities. Number 5. Frequent urination and excessive thirst. Frequent urination and constant thirst are two of the most common and important signs of diabetes, especially in women. These symptoms arise because the body struggles to regulate blood glucose levels. When there is too much sugar circulating, the kidneys work harder to eliminate it. Since they cannot reabsorb all the glucose, it is excreted in the urine, pulling water from the body and increasing thirst. This vicious cycle, drinking water, urinating frequently, and remaining thirsty, can be exhausting and directly affect quality of life. Many women mistake these signs for heat, fluid intake, or even urinary infections, delaying diagnosis. Managing these symptoms requires attention to blood sugar levels. A routine that includes a balanced diet, regular exercise, proper medication use, and medical supervision is key to keeping blood sugar in check. Drinking water is important to avoid dehydration, but should be done in moderation to prevent worsening urinary frequency. Talking to healthcare professionals helps tailor treatment to each woman's needs, preventing complications and supporting overall well-being. Number 6. Changes in body weight. Changes in body weight, particularly unexplained weight loss or difficulty losing weight, may signal diabetes in women. These changes are directly related to how the body uses insulin and glucose as an energy source. When there is insulin deficiency or resistance, cells cannot absorb the glucose in the bloodstream. As a result, the body starts using other sources such as fat and muscle, leading to rapid involuntary weight loss. On the other hand, insulin resistance, common in type 2 diabetes, makes it harder to lose weight even with diet and exercise. The body perceives an energy deficit and stores more fat, especially in the abdominal area. High insulin levels also increase hunger and fat storage, creating a tough cycle. To manage these changes, a personalized and comprehensive approach is essential. A diet rich in fiber, lean proteins, vegetables, and whole grains helps maintain satiety and stabilize glucose. Reducing intake of refined carbohydrates and simple sugars is also key. Regular physical activity improves insulin sensitivity and helps regulate both weight and glucose levels. In some cases, medications may be necessary to stabilize glucose and support weight loss. Nutritional and endocrinological guidance allows the treatment plan to be adjusted to each woman's needs. Recognizing that weight variation may indicate more than aesthetics is the first step toward proactive and effective healthcare. Number 7. Excessive fatigue. Persistent tiredness, even after a good night's sleep or during simple daily activities, may be a clear sign of diabetes in women. This constant fatigue is linked to the body's difficulty in converting glucose, the main energy source, into fuel for cells. When insulin is lacking or resisted, sugar remains in the blood instead of being absorbed, causing ongoing exhaustion. Additionally, high glucose levels contribute to inflammation and oxidative stress, which also reduce well-being and deplete energy. Many women mistake this fatigue for stress, a busy routine, or lack of rest, not realizing a metabolic issue may be involved. Effective treatment starts with strict glucose control, monitoring blood sugar regularly, maintaining a balanced diet, and engaging in physical activity helps stabilize energy levels. Eating at regular intervals, choosing fiber-rich foods, proteins, and healthy fats prevents glucose spikes that cause energy fluctuations. Staying hydrated, getting enough sleep, and reducing stress through meditation or enjoyable activities also promote balance. If fatigue persists, medical evaluation is essential to adjust medications and rule out other causes. Identifying and treating fatigue as a diabetes symptom can greatly improve daily life and restore vitality. Number 8. Slow wound healing. Wounds that take a long time to heal are one of the clearest signs that something is wrong, and in women, they may indicate diabetes. High glucose levels impair circulation, making it harder to transport oxygen and nutrients essential for skin recovery. This causes simple injuries like cuts, scratches, or calluses to heal slowly. In addition, the immune system weakens when diabetes is not controlled, raising infection risks and further complicating healing. This combination can turn small injuries into serious wounds, especially on the feet and legs, requiring ongoing care. The best way to prevent this is to maintain glucose control through healthy eating, regular exercise, and proper medication use. Skincare is also essential, cleaning wounds thoroughly, keeping them protected, and avoiding trauma. A diet with nutrients that aid tissue repair such as vitamin C, zinc, and protein should be included. Avoiding tobacco and encouraging circulation with light walks are also helpful. In more serious or persistent cases, seeking medical attention is ideal to determine the best treatment and avoid complications like deep infections or ulcers. Attention to detail in skincare makes a big difference for women with diabetes. Essential health tips for women. Take care of yourself at every stage of life. Women's health is a lifelong journey that deserves constant attention, care, and dedication. It is not only during times of illness that care is needed. In fact, prevention plays a far more powerful role in maintaining wellness over the years. Paying attention to physical, emotional, and mental well-being on a daily basis helps women lead more balanced and fulfilling lives. Simple actions, when practiced consistently, can lead to remarkable improvements in health, vitality, and quality of life. Here are essential health tips for women, designed to support you at every age and stage. Maintain a balanced diet. Good health starts with the food you eat. Every meal is an opportunity to nourish your body, provide energy, and prevent disease. A balanced diet is one that includes a variety of natural, nutrient-dense foods. Give preference to colorful vegetables, seasonal fruits, legumes like lentils and chickpeas, whole grains such as brown rice and oats, and lean proteins like fish, eggs, tofu, and skinless poultry. Avoiding ultra-processed foods is one of the most powerful steps you can take for your health. These products often contain large amounts of sodium, unhealthy fats, and refined sugars, which contribute to weight gain, hormonal imbalances, and increased risk of chronic diseases. Instead, opt for homemade meals when possible, read labels carefully, and prioritize fresh, whole ingredients. The benefits of a healthy diet go far beyond weight control. It supports immune function, brain health, hormonal balance, and mood stability. It also helps prevent conditions such as type 2 diabetes, obesity, hypertension, high cholesterol, and certain cancers. Eating well is not just about nutrition. It is a daily commitment to living with more energy, longevity, and vitality. Engage in regular physical activity. Physical activity is one of the cornerstones of a healthy lifestyle. While it is often associated with appearance or weight control, its true value lies in its ability to protect the body, sharpen the mind, and lift the spirit. Moving your body regularly strengthens the heart, improves lung capacity, enhances circulation, and promotes joint and muscle health. Exercise is also essential for emotional well-being. It reduces stress, combats anxiety and depression, and boosts endorphin production, the brain's natural feel-good chemicals. Activities like walking, dancing, swimming, strength training, Pilates, or yoga can be adapted to any fitness level or schedule. The most important factor is consistency. The ideal recommendation is to dedicate at least 30 minutes per day, 5 times per week, to some type of physical activity. However, even small changes like taking the stairs, stretching during breaks, or going for evening walks can bring benefits. Choose an activity you enjoy and turn it into a routine. Your body and mind will thank you. Take care of your mental health. Mental and emotional health are often overlooked, yet they are just as vital as physical health. Women, in particular, face a wide range of responsibilities, from professional roles to family care, and may feel overwhelmed, anxious, or emotionally drained. Ignoring these signs can lead to deeper imbalances over time. Prioritizing your mental well-being starts with recognizing your limits and needs. Set aside moments for yourself, even if they are brief. Practice hobbies you love, take quiet breaks during the day, listen to music, read, or spend time in nature. These small acts of self-care help recharge your energy and restore emotional balance. When feelings of sadness, irritability, or fatigue become persistent, seeking help is a sign of strength, not weakness. Therapy offers a safe space for expression, healing, and growth. Speaking with a mental health professional can help you understand your emotions, develop coping strategies, and navigate life's challenges with more clarity and resilience. Get preventive screenings. Regular health checkups are crucial for early detection and prevention of disease. These appointments are not only for when something feels wrong, they are opportunities to monitor your health, identify risk factors, and catch conditions before they become serious. Routine visits to a gynecologist allow for essential exams such as pap smears, pelvic ultrasounds, hormone evaluations, and mammograms. These screenings help detect cervical cancer, breast cancer, hormonal imbalances, polycystic ovary syndrome, and other conditions in early stages when treatment is most effective. In addition, checkups with a general practitioner or specialist can monitor blood pressure, cholesterol, blood sugar, thyroid function, and other vital indicators. Keeping these parameters under control plays a critical role in preventing chronic illnesses like type 2 diabetes and cardiovascular disease. Make it a priority to schedule regular exams and follow up on any concerns promptly. Stay hydrated and sleep well. Hydration is fundamental for nearly every function in the body. Drinking enough water throughout the day helps regulate temperature, supports digestion, protects the joints, maintains kidney function, and enhances skin appearance. Many women underestimate the importance of hydration, especially when busy or stressed. Keep a water bottle nearby and make drinking water a daily habit. Alongside hydration, quality sleep is a non-negotiable pillar of good health. Sleep allows the body and mind to recover, regulate hormones, process memories, and strengthen immunity. Sleep deprivation is linked to mood swings, weakened concentration, metabolic disturbances, and even weight gain. Aim to sleep between 7 and 8 hours per night. Create a calming bedtime routine by disconnecting from screens, dimming the lights, and practicing relaxation techniques. A consistent sleep schedule, even on weekends, helps regulate your internal clock and supports better overall functioning. Pay attention to your emotional and spiritual health. True well-being goes beyond the physical. It involves your inner world, your emotional resilience, and your connection with life's deeper meanings. Emotional and spiritual health are about cultivating a sense of peace, purpose, and connection, both with yourself and with others. Practices like journaling, prayer, meditation, or spending time in reflection can help manage stress and build emotional clarity. Surrounding yourself with supportive relationships, expressing gratitude, and creating moments of joy and silence all contribute to emotional nourishment. Spirituality can be deeply personal and does not have to follow a specific religion. It may involve connecting with nature, participating in community rituals, or simply aligning your actions with your values. These inner practices help you stay grounded, focused, and emotionally strong during life's ups and downs. Remember, health is the sum of your choices. Small, conscious, and consistent actions help you live better, both now and in the future. Care for yourself with kindness. You deserve it. Recognizing the 8 most common signs of diabetes in women is an essential step in taking control of your own health. By understanding how the body signals internal changes, it becomes easier to act quickly, seek medical guidance, and begin proper treatment. Early detection is a powerful ally. The sooner diabetes is identified, the greater the chances of controlling the disease, avoiding complications, and maintaining quality of life. Being well-informed empowers women to make healthier choices and promotes long-term well-being. Health starts with knowledge and action. If you made it this far, congratulations on dedicating time to your health. We hope this information has helped you better understand the signs of diabetes and the importance of prevention. If you identified any of these symptoms, do not hesitate to seek medical advice. Here at Your Health, our commitment is to your well-being. If you enjoyed this content, like the video, share it with other women, and subscribe to the channel so you do not miss any tips. Stay with us and check out one of the suggested videos now appearing on your screen.